All right, great. Well, I guess we'll get started. We're waiting for a bunch of people to filter in, but I think it's probably a good idea just to get started. Thank you very much, everyone, for coming. I think, well, I'm personally very excited to see all these people in the room, a lot of people that I've interacted with over the years that I never get to see all in one place. Especially, I'd like to thank you for making your way to Boston in February. A couple people told me this was the worst move possible, but the weather is actually holding up for now. I won't say anything else on that. But anyways, so for now we're doing okay. So I just was going to give you a quick context for why we put this meeting together, why we're all here in the same place, and sort of just as an introduction to why we want to have a meeting focused on this topic. So of course, a lot of us in this room are all focused on this topic of how to detect events, public health events early in populations. This is just a listing of some number of events that have been of international significance over the last 15 years. And really, the goal has always been early detection with the hope that that's going to improve public health practice. And so early detection hopefully means early response. And the challenge of early detection has been one that we've all struggled with because of a number of reasons, including the fact that traditional public health reporting in its hierarchy can be extraordinarily slow. And information that flows from local populations up can take on the order of weeks or months. And we all recognize that paradigm that currently exists prevents us from really rapid detection of events in populations around the world. And so really that's why the framework of digital disease detection, informal surveillance, event-based surveillance, there's a number of names for it. In fact, one thing that would be wonderful out of this conference is actually come up with a name for the field. There still isn't really one. Online epidemic intelligence, another one. But the idea is, how do we reduce barriers to information access where there's a number of stakeholders involved in public health and really make information multi-directional. And that really has been the challenge and the opportunity that we've been faced with. The paradigm that we've all worked with is the idea of all the information that flows up in the course of an epidemic, all the social media information from mobile technologies, all this data together represents unique opportunity to examine population health. And that has been really one that many of the groups in the room have been pioneering for the last 5, 10, even 20 years. So really, the idea is to think through how one can do that. We know that, in fact, in a study that we did a couple of years ago, that in fact, these information sources, as they are valuable to various health organizations, are actually having an impact on decreasing the time to outbreak detection. Of course, there's a number of factors that are influencing the speed of detection, but informal event-based data is having direct impact on the speed of information flow. So the rise of digital disease detection has really given way to some really exciting opportunities. And honestly, one could not talk about this field without referring to two specific systems, ProMed, which represents the first infectious disease social network, and GFIN, the first infectious disease web crawler. And really, there's a lot to be owed to those two groups in terms of the way that they've brought up this technology. And I'm sure most people in the room are highly familiar with these two groups. If not, they're represented in this room, and you should definitely talk to them. But as a result of all that work, a number of organizations have been working on this effort for many years now. And there's a lot of disparate efforts that transcend industry, academia, government. So a number of efforts, a lot of groups, new and old, that have been trying to do this. But there's been a lot of disparate efforts. And part of the reason for putting this effort together today is to bring this disparate community together into one room. And the idea was to really encourage collaboration that has a direct impact on public health practice, because that's really why we're doing this kind of work, and to really try to prioritize research in this space. There's a lot of different research concerns that are going to be brought up over the next couple days: novel data, the issues of evaluation, the utility of this data, privacy, security, signal detection, all sorts of, and these are things that are not new to our community. Patrick Meagher is going to actually be talking soon about how the crisis mapping communities face these very similar challenges. And so I think there's a lot to be learned from crisis mapping. We have people from the International Society for Disease Surveillance here who've been struggling over the last decade with these issues in syndromic surveillance. And so they're not new concepts. They're things that we just have to think about very clearly in this community. And the idea is really to try to define a vision for this topic going forward, digital disease detection, or whatever we want to call it, as really a new discipline. And that's the purpose of bringing all these people together in the room. So just to give you a sense of who actually came, for over 200 attendees, or at least there will be by the end of this day, hopefully, from 17 countries. And interestingly enough, 92 institutions spread evenly across academia, government, and industry NGOs. So it's a really nice split to see that there's a really a number of different types of organizations that are stakeholders in this concept. Just in terms of the layout for the conference, we've tried to keep a diverse set of topics and ways of communicating information, from keynotes to this challenging rapid-fire talk that I know I had some pushback on, but we'll see if it actually works out. Panel discussions and tech demos tonight, and then we'll repeat and do more of the same tomorrow with actually a big data plenary, which will be pretty exciting, and then a great conference summary by Phil Palgreen. So that's the layout. I wanted to introduce Dr. Taha Kass Hout, who's a sponsor of this from CDC, who's also been a close collaborator and colleague in this space for quite some time. So I'll turn it over to Taha to say some words. Thanks.
Well, I mean, thank you so much. Yeah, my name is Taha Kass Hout. I'm with the Centers for Disease Control Prevention in the US, or CDC. We're really happy to support John's first digital disease detection conference, and hope that we see more innovative work advance in this field. I mean, Twitter and Facebook and blogs and searches, all of which are blocked behind our firewall that we can't see, but we do believe in your work. So.